Well, a warm welcome to today's update. It's Friday the 26th of March. Now I'm going to start with a bit of a crystal ball gazing, but it's a very scientific crystal ball. So let's just have a look at that first of all. It's good news actually. So here we see the daily COVID vaccination doses administered per 100 people. The United Kingdom is quite high. Then the United States, but the United States is going to be accelerating and will probably overtake the United Kingdom in the next few weeks. Pity about Australia and New Zealand, of course, with supply issues. And then we see other countries here, Canada, grouped with the low vaccinating European countries, France, Germany, Spain and Ireland. We notice with sadness there that the vaccination levels are lower in Ireland even than in other European countries. Now we mentioned Israel there, so let's just look at the data from Israel. Now this is the COVID vaccine doses administered per 100 people in Israel. So we see it's well over 100 doses now per 100 people, and of course that means many have now had their second dose. But the question of course is this starting to have an effect? Now social compliance in Israel has been very difficult in quite a few sectors, and we've looked at this before. So there's been difficulties in Israel, there's no two ways about that. But the vaccination programme is being a spectacular, rapid success. So we have this rapid increase in vaccinations, but what effect is it having? Well, we can't say that this effect is entirely due to the vaccines, but it's certainly got to be a big part of it. So we see a dramatic drop in new confirmed COVID-19 cases per million people. It's still a way to go. It's not eradicated, not by any means, and there's still people left to vaccinate and there's still social distancing needed. But that is looking really remarkably encouraging. But what about the feed through into deaths? Because disease is one thing, well, deaths is another. Well, this is the chart for deaths here. And again, we see a drop off. Now, it's delayed in time, of course, as we would expect. I don't know if this is a genuine upturn here or an artifact, but the general trend is really remarkably good as the general trend goes down. And I see absolutely no reason why all countries with good vaccination numbers should not be like Israel, albeit with a few weeks or in some cases a month or two delay. This is the power that vaccination can have. And that's why I'm optimistic. Now, a bit of news today from the UK, the United States, and we're going to look at India as well. Difficult to assess what's going on in India, but we'll have a look at what we know. Now, starting off with the past 7 days in the United Kingdom. This is the official government site data. This is from this official government site. We do see a nice drop-off in cases, but we also see a bit of a levelling off. And according to this data, cases are still going down, but we're going to question if that's actually happening, because there's a slight contradiction between the official government data and the COVID symptom tracker app data. Anyway, sticking with the official government data first of all. Now, this is the number of cases over the past week. Now, of course, often we look at the number of cases per day, but that does fluctuate quite a bit. Tends to go down on weekends, tends to go up on Tuesdays because more people are reporting. So it's probably more useful to look at the 7-day averages. And this is the number of cases over 7 days. So there was 38,424 cases, new cases diagnosed. This is positive tests cases. In the past 7 days, down 2% on the week before. Not a big drop off. I mean, 2% is not massive, is it? Anyway, deaths, good, because deaths down. So there was an additional 520 deaths in the week within 28 days of a diagnosis. But this is a reduction of 31.4%. And this is very, very encouraging. And again, this is because the older groups were vaccinated first, the groups that were most likely to die. So vaccination is the main factor bringing the death rate down. So we see the death rate falling quicker than the infection rate, which is what we'd expect. So infections might stay reasonably high, but deaths will carry on going down as vaccinations are rolled out. That's going to be true wherever you are. And eventually that's going to turn COVID from a life-threatening illness into a non-life-threatening illness, and hopefully eventually into just a trifling inconvenience, and then hopefully into oblivious non-existence is what I still believe is possible. So admissions to hospital, now still nearly 3,000 admissions to hospital in the week. It's not insignificant, but it's down 19.8% on the week. People in hospital, a bit of a delay on this data, but this is actually the latest we've got from the website. 5,544 on the 20th of March. But given that's 6 days old now, we would expect that to be lower as the vaccination effect, the protective effect of severe disease, hospitalisation and death of the vaccine kicks in for more and more people, starting with the highest risk groups. And I think this really is a bit of a vindication for the UK vaccination strategy, actually. Seeing these deaths coming down, I mean, we had appalling levels of death. And I believe the main reason the deaths are coming down is the vaccination strategy. And I believe that's vindication of the UK government's choice to give the one dose followed by the 10 to 12 weeks delay before the booster dose. I think we can see this working before our very eyes now. And it, this is transposing into saving many, many individuals. So it's good. Bed occupancy is down 50% from its peak. It was 50% at its peak, and it's now just below 5%. So when was the peak? It must have been about early February, was it? Late January, early February. 50% of patients in hospital at the peak were in hospital because of COVID-19. Now it's under 5%. Now that's still a strain on the health service. It's still 5% of the totality, or just under 5% of the totality of people being treated in the United Kingdom. So it's still a problem. But it's a lot better than 50%, that is for sure. First dose of vaccine, 29 getting on for 30 million. Second dose of vaccine heading towards the 3 million point. But as we said, the United States will probably overtake us. It's not a race, of course, but the United States probably will overtake us because supplies in the United States are going up. We're going to have supply issues in the United Kingdom end of March into April, potentially for all of April. We don't really know yet, but the supply is not going to be what it was, unfortunately. Now, looking at the COVID symptom tracker app data now, so we see the prevalence, the number of people with the infection at the moment, 71,168, and we see that there's regional differences. New daily cases we see roughly the same as the official statistics there, 5,545 people starting to report symptoms in the past 24 hours. But this is the bit that's a bit concerning. So obviously we've got the new variant kicking in there, we've got the lockdown, but here we are seeing a levelling. I don't think there's any question of that. We are seeing a levelling to certainly it's not dropping off as quickly as it was, is it? It's a reduction in the rate of cases dropping off, and that's the main point that Tim Spector was making on his update this week. Now, do check this out for yourself. That's the COVID symptom tracker app there. That was Tim Spector's talk on the week's update. So what Professor Spector is saying, flattening of new cases has been about 10 days now. So he says the R0's around about 1. Now, the official figures as of this morning were, I think, 0.7 to 0.9. But from the COVID symptom tracker app data, which is often more current, around about 1. So basically what the official data is saying is that the cases in the UK are dropping off very, very slowly. The COVID symptom tracker app data is saying they're more or less level actually at the moment. And we'll be seeing that there's issues relating to the United States about this as well. In fact, we'll just look at that now. These are the figures for the United Kingdom. We see this levelling. And we saw the levelling for a while in the United States, but are we starting to see a bit of a pickup? So again, in the United States, we can certainly see a levelling like as in the UK. And the United States may have a bit of a pickup. As we've said before, it's a very finely balanced race between vaccinations and new infections and new variants in the States. Very finely balanced. Just hoping that the new variants lose and the acceleration of the vaccine programme prevents a third wave in the States. But anyway, getting back to the UK, round about 1 in 920 people have symptoms, according to the COVID symptom tracker app, over the last week. So a great reduction, but no longer dropping off as rapidly as it was or staying flat. So Professor Spector's talking about the reasons for flattening on his broadcast. Now, he does admit there's some false positive cases, up to about 1,000 per day, so that is quite significant. Now, the PCR tests, of course, are really quite reliable, but data is also coming in from these lateral flow tests, which, as we know, are much less reliable. So false positives definitely coming in there, perhaps about 1,000 a day, according to Tim Spector's estimate. Now, more infections in people under the age of 50, and particularly under the age of 19. Again, exactly what we would expect because of the protective effect of the vaccine in the older age group. Exactly what we would expect. And we did anticipate this. We were talking about this some weeks ago, that this is the pattern that we would see, and we are seeing it. So that really, again, it is confirmation of the fact that the vaccination program is working. As predicted due to vaccination, so we've been predicting this for about a month now. Now, Professor Spector's saying he's definitely got cases of reinfections. From the COVID symptom tracker app, which between 1 million and 2.5 million people typically fill out, 352 people were reinfected. Now, there's nothing to indicate that these people were sick, but they have been re-diagnosed. So we are seeing a very small amount of reinfections. It is a small amount of reinfections. It's a very small amount, but it is a real effect. But of course, we know that already from the study we looked at in healthcare workers in the northeast, the Siren study that's still ongoing. We knew that this would be a factor to some extent. And again, it's panning out roughly where we thought it would, and it's not going to be a massive factor from the data that we currently have. So I'm not too worried about it, and I don't think Professor Spector's too worried about it either, but it is real. He did say overall immunity is working well, so yes, we have this. No, it's probably not a big problem. Overall immunity is working well. Half the population vaccinated in the UK, so as we've seen, Israel is leading. I think the United Arab Emirates is doing quite well, Bahrain is doing well, but these are smaller population areas. So in terms of larger population areas, the UK is doing well, but will be overtaken by the United States, we predict at the moment, or I'm guessing at the moment. Now, Professor Spector's saying from the COVID symptom tracker data, 74% protection from the vaccines after the first 30 days. Of course, I hear you saying, well, what vaccine are you talking about? Well, he's saying that they're both really quite similar. You need to get vaccinated. The particular vaccine is not making such a difference. Overall, 74% protection against getting the infection. And of course, much higher protection against severe COVID and death, particularly after 2 doses. But note, and Professor Spector stressed this, first 30 days. After 30 days. After 30 days. It's taking 30 days to kick in. 0 protection for 12 days. So protection is building up from 12 days after your first injection to 30 days. The full immune effect is not there till 30 days. But even then, you're not getting the full immune effect till the second vaccine, although there's some immunity after 30 days. But do remember that, 0 protection after 12 days. And do remember, don't care where you live, if you live in Israel, the United States, the United Kingdom, wherever you live, remember that the cases in Israel went up for the first 8, 9, 10 days after vaccination. Certainly they went up for a period of time because people let their guard down and they had zero protection after vaccination for the first 12 days, and not significant immunity protection for the first 30 days. So it does take time. After my vaccination, I was literally counting the days. It's been 7 days now, there'll be no protection. It's been 10 days now, there'll be no protection. And then even though you mustn't let it change your behaviour, and at the moment you must not, but it is good to know that after three weeks you are getting a level of protection and significant protection against severe disease and death, which of course has been an omnipresent possibility all throughout this pandemic. In my age group, it's not insignificant, and it's a risk in any age group. Risk of new variants. Professor Spector's not worried about this at the moment, so if he's not worried, I'm not worried about it. So risk of new variants is fairly minor after vaccination. Now, where should we be going? And this is true of wherever you live, of course. This is universally applicable, not just the UK. Greater awareness of symptoms, testing everyone with symptoms. So Professor Spector here is saying that although, of course, we want to recognise the specific symptoms, and his COVID symptom tracker app has been instrumental in us understanding that, he's saying be suspicious of all symptoms. Just get tested. You know, if you remote any symptoms at all, don't think too much about it. Just get tested. But then after testing, you have to isolate. This has been the big failure of this pandemic. We need to do a better job of isolation. You can get tested. It's a glorious irrelevance if you don't isolate afterwards. The whole point of testing is so that you know you need to isolate, and it's not being well done. And I must say, just have a bit of a gripe at the moment. I don't watch much TV. It's so boring. It's all the same. But I do watch things occasionally. And on the BBC and the ITV channels in the UK, they have people sitting in a studio 2 metres apart. But there's maybe 4 of them all sitting around having a drinking chinwag, you know, rabbiting on about some irrelevance. And there's no sign of a draft through the studio. So you will get aerosolization effects. This idea that 2 metres, end of problem, zero transmission. The simplicity and the sheer the scientific inaccuracy of that really annoys me. You know, it's such an appalling example. You know, and you can just no evidence of ventilation whatsoever. And yet, you know, with this bad example from these national people. We expect each individual to comply with isolation measures. It's you know, it's almost like there's one rule for the celebrity the celebrity types and one rule for the rest of us riffraff. This celebrity culture where people are famous for being famous and do what they want is simply not on. But that's the way I interpret it. That's the way I see it. End of rant. Apologies about that. Full vaccination, Professor Spector thinks we'll be getting back to normal, and confident we will soon be through this. So a lot of confidence there, which is good. We're not there yet, but the direction, as we saw from the Israeli data at the start of this, is good. Regional differences in the UK. Wales and Scotland are higher rates because the schools went back earlier. Now, there is evidence of increased infection in not so much in junior schools below the age of 11, but from the age of 11 to 16, there's definitely increases in infection. The schools in Scotland and Wales went back earlier, so that is now spreading out into the community. We expected this. We anticipated this, but it is happening. West Midlands, an upward turn. West Midlands has been a lot of virus for a long time. It seems very difficult to go away. South east of England and London, though, cases going down really quite nicely. So, good update there from the UK. Do check on Professor Spector's original. Make sure I've got it right. United States, 200 million vaccinations in the first 100 days will now happen. I am firmly predicting this will happen. That is by the 30th of April, the United States will have vaccinated or given 200 million doses of, will have given 200 doses of vaccine. That is now going to happen. It's a spectacular success, and it will be overtaking the UK and other countries as well. It's impressive. It's impressive. So average of 2.5 million doses a day last week. And the reason I'm being so confident is the United States has been so regularly exceeding the 2 million mark. And if you actually work out the average to get 200 million doses delivered by the 30th of April, all they have to do in the United States is to deliver 1.9 million doses a day, and they'll do that. So that is... This is saving so many lives in the States, because just remember, look at this. You know, the new variants are coming in the States now. We looked at the lamentable data from the Centers for Disease Control yesterday. We know they're more prevalent than they're saying. It's flattening, and without the vaccines, it would be going up. Probably, well, yeah, already I believe it would be going up. And I'm just hoping it may go up a bit. We have anticipated for some time that there'll be an increase in cases in the United States in March. Oops. So I do think there'll be an increase in cases, a small increase in cases. But because so many vulnerable people have been vaccinated already, that increase in cases will not result in an increase in death rates. And then the numbers are going to go down because of such mass vaccination. So that's good. European conflab yesterday, they decided not to have an export ban. Dr. von der Leyen says, I think it's clear that, first of all, the company has to catch up, talking about AstraZeneca, has to honour the contracts it has with the European member states before it can engage again in exporting vaccines. So the background to this is that the UK ordered vaccines March, April, May. The European Union didn't put their orders in till like August, September. So the first contracts are being honoured, and clearly this is a source of massive embarrassment for this complete, failure of the European purchasing authorities. And what they're saying now is, because so many vaccines are produced in Europe, they're not going to have an export ban. But at the same time, she's also saying that the European companies, AstraZeneca has to honour the contracts it has with the European member states before it can engage in exporting vaccines. So it seems to me she's saying they can export, and it seems to me she's saying they can't export. So that's saying they can export, that's saying they can't. If you're a politician, you will understand that. Ordinary people like me don't. I see a contradiction, they apparently don't. End of that. I really don't care about these politics. We really need to get people vaccinated, and we just need to get people vaccinated. It's just so frustrating that this is being politicised. Right, anyway, India. Now, I put up a graphic here, if I can find it. Yeah, this is the population of India. Lifetime from World Meter. Now, I prepped this about 2 hours ago, and this was the population of India at that time. Now the population of India has gone up by quite a bit. Can't quite work it out in my head, but that's the population of India now. 1.39 billion. What does that mean? What is that number? My head can't make any sense of that. I can't compute that number. So absolutely huge population in India. But what's going on pandemic-wise? Cases are increasing. There's been an increase in cases. We don't know to what degree this is an underestimate, clearly an underestimate, but it's the highest figure since October. Higher proportion of cases seem to be asymptomatic, so that's encouraging. And the official deaths remain low. So does this mean the pandemic's not so much of a problem in India with the high number of asymptomatic cases? Good to see that. Anyway, this is the graph for India here. So we've got February, that's February 2020, that's March 2021. So that's from the very start of the pandemic. So we had a bit of a wave there. Peaking, India's first wave there peaked in September, that's about September 2020 that peaked. Coming down nicely, but now definitely going up. The case is, will a lot of cases remain asymptomatic? Will this carry on going up? Because the Indian vaccine rollout is not very high in terms of per capita of the population. And there are some new variant factors that are a bit of a concern, which I want to talk about. So factors in cases going up in India: change of behaviour, yes, there does seem to be. Waning immunity amongst those previously infected. So remember, some people in India were infected back in, what are we looking at here? Back in early part of 2020. Are we saying immunity for people infected in this kind of time span is wearing off? Well, the data's not very good, But the experts are saying that this is a possible factor, so we have to assume this is a possible factor. I would be surprised if it's a big one. I'm expecting immunity for most people to have a degree of longevity. But what is more likely to be happening is, as we'll see, there's a new mutant in India that might be reinfecting people. And we know from the UK data that a minority are being reinfected, although not a large number. So I'm not expecting it to be that big a factor, because it's the data where we have accurate data in the UK, as we talked about, the reinfection rates are not very high. Now, originally in Mumbai, a city that used to be called Bombay in Maharashtra, 90% of cases now are not in the slums. Now, in the first wave, they were where people are living in very close proximity, very basic housing. I've got some unpleasant memories of that area myself. People living in remarkably difficult situation. So it wasn't surprising that the disease spread in those areas. But now it's spreading in non-slum areas. So again, this is somewhat re-encouraging, because it implies to me that many of the people in the slum areas in Mumbai do have a level of immunity. Otherwise, it would be spreading, reinfecting people there. So the fact that there's not so many cases in the slums means that this is probably not such a big factor as some of the experts are saying. I believe that's not such a big factor, based on this information that it's not re-spreading in the slums. And when I say the conditions are appalling, that they are. Whole families living in one room, if they're lucky. Possibilities for social distancing in work or living accommodation, zero. So it's not re-spreading there. That encourages me. People are not being reinfected at a massive rate. Massive internal movements and commuting. I can't remember the figure. I think it's something like 10 million people in Maharashtra, around about the Bombay area, take the train every day. It's unbelievable if you ever make the mistake of travelling in rush hour. New variants are a possibility and are happening. And coming on in India, we've got elections and these mass festivals they have, the Kumbh Mela, where, 10, 20 million people descend on the banks of the Ganges, and then go to all parts of India. So they come from all parts of India. They are crammed together in accommodation at the Kumbh Mela around about the Ganges, and then they'll spread to all. They'll go back home to all parts of India. Clearly, a risk of a super spreading event. Let's hope not, but the risk is there. Vaccinations up to about 50 million, but remember the population's nearly 1.4 billion, unimaginable numbers. But they're saying all Indians 45 years and older are eligible for vaccines from the 1st of April, so they must be stepping up the supply. The supply comes from the Oxford AstraZeneca, which is why exports to the UK are being restricted. And this Covaxin, this Bharat Biotech Covaxin, is an indigenous Indian-produced vaccine. So obviously this one was developed by Oxford University in combination with AstraZeneca. And AstraZeneca make huge amounts of vaccines at the Pune plant, which is I think Pune's still in Maharashtra. It's close to Bombay anyway, where they make massive amounts of vaccine, but the Oxford AstraZeneca vaccine. But this Covaxin one is actually developed by Indian scientists and developed in India. And it occurred to me when I was doing this, we haven't really looked at this. So it's an inactivated vaccine. So what the Covaxin people do is they brew up massive numbers of the virus. So they must use cell cultures, and they brew up huge numbers of viruses. Then basically kill the viruses and they inject the whole dead virus. So it's an inactivated viral vaccine. Standard way of doing it, an old-fashioned way of doing it, but seems to work. Clinical trials so far, interim results, 25,800 people reported. Interim efficacy result, 81%. So looking good. Now, we don't have the data of how many severe cases and deaths it's protecting against, but I would expect it to be very high, as the other vaccines have proved so far. So 2 vaccines being rolled out there in India, which is good news. Now, just looking at the variants, Punjab in the north, February to early March, 80% of cases UK variant, so that caused the increase in Punjab. South African Brazilian variants present but a lower level. The Brazilian variant has been detected, but it's a minute level. But there's a new Indian variant, mostly in Maharashtra, where a lot of the spread is taking place in and around Mumbai at the moment. 2 mutants that confer immunity escape. In other words, people can become reinfected, the Indian authorities are saying, and increased transmissibility. So bad combination. So here, again, spike protein, the 484th amino acid has been changed from the E to the Q form. And as well as that, in the same mutation, the point 452, the 452nd amino acid, the L form of the amino acid has been changed to the R form. And that change means that the immune system can't recognise it as well, and it's more infectious. And that's currently in 15 to 20% of samples. So if it's significantly more infectious, that means that will probably rise to about 90% exponentially, really quite soon now. And this Indian mutation, this E to Q and L to R, does not match any previous variants of concern. So this is a new one. We can call this the India variant. That would be legitimate. And in Kerala, there's another one where the N has been changed to the K at the 440th position. So concerns about India there, and the huge number of people there means, of course, that if there's a lot of infections, it means there's just so many opportunities for the virus to mutate. And as we see, at least 2 new mutated strains of the virus there. And of course, that virus won't respect international boundaries. If it outcompetes the other more transmissible strains, such as the Kent strain, then it will tend to become more prevalent, indicating that we need to get the viral replication down everywhere around the world, because the virus can't mutate without replicating. And if we get the number of infected people down, we'll get the replication down, we'll stop the mutations, and hopefully we'll stop these waves of variants that are causing the global increase in cases at the moment. It's just why it's so important to get everyone vaccinated as soon as we can. Let's hope we have an Apollo program. Let's hope we have a Manhattan project. Let's hope we have whatever the biggest project in the world has ever been, and get everyone vaccinated. Okay, that is us for today. A bit longer than I expected, but thank you for watching.